So welcome on this beautiful afternoon in Turin. It's a great pleasure to welcome you here. So my name is Jos Vaassen. I work at the Global Evaluation Initiative and also at the Independent Evaluation Group of the World Bank. And it's really my pleasure to welcome you to this session, which is on the topic of evaluating national policy responses to the COVID-19 pandemic and the role of national evaluation functions in it. So as we all know, the effects of the pandemic, they have been quite complex and far-reaching. The pandemic has affected human lives directly and indirectly, affecting health systems, economic activity and trade, employment and labor markets, and many other aspects of the societies that we live in. And of course, correspondingly, policy responses by national governments, by non-governmental organizations, and international development partners and others have been multi-sectoral and broad in scope. In this session, we will discuss the role of national evaluation functions in evaluating parts of the multi-sectoral COVID-19 response. This in a context where both policy interventions and by association, also the evaluations of these interventions are fragmented. And in this context, national M&E entities are in principle well placed to take a leading role in connecting the dots. So what does this mean? Among many other things, this could be achieved by national entities commissioning and conducting evaluations at higher multi-sectoral levels, and or by elevating the discussion and the learning regarding important parts of the COVID-19 policy response, elevating it to the highest levels of government. So today we have a very distinguished panel of representatives from the OECD DAC and Malawi, Ghana, and Burkina Faso to discuss the purpose and scope of specific country-led COVID-19 related evaluations and how these evaluations contribute to processes of learning and accountability around the interventions that are being evaluated. The OECD DAC and the GEI have been collaborating with colleagues from 3 national central M&E entities in the 3 countries that I just mentioned to design and implement these evaluations. But furthermore, we will also reflect on how such evaluations implemented by a central national evaluation entity in a coordinated manner with other stakeholders, both national and international, can potentially contribute to broader objectives of empowering national evaluation functions and reducing fragmentation of evaluation in the country. This is not an easy goal to achieve, but certainly a goal worthy pursuing. So I will introduce in a minute our distinguished panelists individually as they take the stage. We will start with a presentation from the OECD DAC on the broader initiative in which these different country-led evaluations are embedded. And subsequently, we will have presentations from our 3 country-level colleagues, respectively from Malawi, from Ghana, and Burkina Faso. So after the 4 concise presentations from our panelists, we will have space for some discussion and also taking questions from you in our audience. So it's now my great pleasure to start with the first presentation of today's session. And it is my pleasure to give the floor to Ms. Megan Kennedy. She is the head of the evaluation unit of the Development Assistance Committee, Secretariat of the OECD in Paris. Megan, the floor is yours.
Thank you so much. And thank you to all the organizers and our hosts today for making this lovely occasion possible. And thank you for that great introduction and putting it in context. So I'd like to, I'll share some few slides today to help put into context the work of the COVID-19 Global Evaluation Coalition, which is an international coalition that was formed by evaluation units from various countries, UN partners, multilateral banks, and other stakeholders. And we've been up and running since officially June 2020. And it's my hope that many of you who have been involved or maybe haven't been involved will learn more about the coalition, and we'd love to have you involved in it today. And to hear from you today about your priorities in this area. So next slide, please. Oh, I can do it, yes? Okay, great. So the OECD DAC Evaluation Network is made up of the central and independent evaluation units of OECD member countries, some of whom you have sitting amongst you today, including our Spanish colleagues who are here. And they formed, we will actually celebrate our 40th anniversary, 40-year anniversary next year. So these units work together to improve coordination and to improve the methodologies and the approaches used to evaluate international development cooperation and humanitarian assistance. They have long been partners in supporting engagement and evaluation capacity developments. But of course, when you look at the mandates of many of these evaluation units, let's say USAID's Evaluation Department or DEVAL or IEG at the World Bank, they have certain national mandates to look at their own country or their own institutions' international cooperation. But of course, we all know that that support is only one small piece of the picture of what's happening in a particular country in regards to Agenda 2030 and trying to support sustainable development for all. So there has long been a commitment to strengthening the national evaluation systems in partner countries. And I just wanted to read a very small quote that comes from an OECD document. And it says, "It is the developing countries who usually finance most of the cost of aid-supported projects, and it is they who must often execute many of the recommendations. It is therefore hoped that donors will encourage the developing countries by means of training in evaluation techniques, and possibly also by some financial assistance." Nice, yeah. to undertake evaluations themselves, not only of the aid-supported projects, but also of the development projects that they finance out of their own resources. And I read this quote because it's actually from 1975. This document was published by the OECD in 1975. And when the OECD first established the evaluation network, supporting national evaluation capacities in partner countries was one of the 3 primary mandates of the network. So it's a long history, but it's a variable history. As you see, as we've heard many times throughout all the sessions this week, there are many areas of progress and many areas where progress is still needed, including around ownership. And what we've seen is that developing countries have committed to strengthening their systems at the same time as OECD partners and providers of development assistance have committed to using those systems. And I put a picture of a small puppy dog wagging his tail here because of this idea that it's very difficult for evaluation to be nationally owned and led when the development cooperation itself is not nationally owned and led, right? So we saw in around 2005, 2006, with the Paris Declaration on Aid Effectiveness, a peak in the focus of national ownership, national leadership in development priority setting, in development policy setting, and evaluation was a bit of the tail of the dog that was following along. But we see now in the current context in the last 5 to 10 years, a real retrenchment in regards to national ownership and its prioritization. And that's also now being reflected in evaluations to some extent. So the result is that we still have many gaps. As was mentioned, there's still a certain level of fragmentation. And what you see in this curve, I've put this sort of normal distribution curve here to see what we've discovered through our own analysis of our members' involvement with partner countries through an evaluation process. So if you see on the bottom that you can think of that as an evaluation process, and the peak of involvement comes as conducting data collection or hiring people or firms from developing country partners to conduct evaluations. But there's very little involvement in deciding what gets evaluated, deciding the scope or the nature of the evaluation, or in following up and taking action on evaluation for accountability or learning purposes. So there's some need to really look at more of a normal, a flat distribution of flattening that curve. So we see what's the result of this fragmentation and this continued lack of use and lack of capacity and involvement. We see high transaction costs. We see that policy and decision-making is not sufficiently involving local monitoring and evaluation systems, sometimes bypassing or undermining those systems as well. And that means that there are insufficient opportunities for learning by doing. So enter the COVID-19 pandemic. We saw already with, I think, the 2015 Agenda 2030, the universal nature of the Sustainable Development Goals. I'm from the United States. It's a populous country in North America. And we have challenges around evaluating public policies, using evidence to drive results for all Americans. And COVID-19, I think, brought that forward, that all governments everywhere have room for improvement when it comes to national evaluation, have room for improvement when it comes to accountability to the people impacted by public policies. And I think the other really important element about the COVID-19 context is that there was an openness to new approaches. It allowed people to have a beginner mindset, to say, maybe we don't have all the answers, and maybe we are willing to actually ask for help and ask for input from evaluation teams. So many of our members did look for that or received requests for more support than they ever had before. At the time, we saw that evaluators everywhere were working on this. And we came together with partners from the United Nations Evaluation Group, the Evaluation Cooperation Group of the multilateral banks, and partner countries to form the COVID-19 Global Evaluation Coalition. And the goal really was there to put all evaluators on the same level playing field. I'll just go quickly through this. You don't need to look too much in detail, but it's again just reflecting this reality that, of course, international support to respond to the pandemic is just one small piece of the picture. And actually the majority of the response is dictated and owned and led by national governments in most countries. So we are interested in looking not only at the national responses, supporting countries that want to evaluate their own response, and to also look at their perspective in terms of how effective were the international development partners in supporting their response in ways that were relevant, efficient, and coherent. We heard the OECD DAC members all made lots of very big promises back in March and April of 2020. They promised to help leave no one behind. They promised to target the most vulnerable countries. They promised to provide extra support for women and girls, for refugees and migrants. We'd like to know, did they keep those promises? And that's the goal of the COVID-19 coalition. So we've come together, as I said, with the aim of bringing together evaluation units from any government. It is open to any country, regardless of membership in the OECD. And we look at not only development assistance, but also humanitarian cooperation and also national or domestic policies. It's independent and voluntary. There are no membership fees, so you're welcome to join. And we developed a set of overarching evaluation questions. And these 6 questions both help guide individual evaluations and collaborative evaluations. And they also are allowing us to build up an evidence base around key strategic questions. One of the most significant areas of work that the coalition has done was a strategic joint evaluation of the protection of refugee rights during the pandemic. And that was led by Colombia, Finland, Uganda, and UNHCR with support from ALNAP. And that evaluation was launched in July of this year. It's available on the website. Great, thank you. So this brings us to the country-led evaluations. As I mentioned earlier, the Paris Declaration on Aid Effectiveness is an area of inspiration for us. I don't know how many of you may have been involved in the evaluation of the Paris Declaration, but it took a very innovative approach, which was to actually support countries to evaluate the donors and the development cooperation providers in their own countries with country-led evaluations. So the idea here is really to provide a pool of resources and technical support from GEI to strengthen capacities through a learning by doing approach. So we'll hear from partners today about their ideas and where we are. We're also really excited to hear from them about what we can do better to support them and others of you who are interested. And I also wanted to just raise this, again, one final point to close with, is that we are looking at a strategic evaluation of the overall response. So trying to ask some of those questions of coherence and impact that no one country or no one agency can answer themselves. And for that, we are looking for case study countries that would be interested in evaluating the response in their country. So it's a pleasure to be with you all today, and I look forward to hearing from the partners. Thank you so much.
Thank you very much, Megan. We will continue with our second presentation, but just a quick reflection. When talking about capacity development, it shows once more when working with excellent teams in our partner countries that capacity development is really a two-way traffic. It's two-directional traffic. So basically, it's a situation in which different individuals basically know different things. And capacity development is really much more than individual capacity development. We have excellent colleagues across the globe some of which who know much more about particular things for evaluation than any expert in an international development setting. But often it is also the purpose of, let's say, the international collaboration to really help raise the cause of evaluation. So to really put also kind of an institutional support to help champions of evaluation in the countries to really move their work forward and their evaluation agenda forward. So that having said, it is now my great pleasure to introduce our colleagues from Malawi, here represented by Ms. Sophie Kangoma. She is the Director of the Monitoring and Evaluation Division of the Ministry of Finance and Economic Affairs in Malawi. It's a great pleasure to have you here, Sophie. The floor is yours.
Thank you, Josie, and thank you everybody for being here to listen to what we do have. I can say that we are a new kid in the block. Sorry, my voice is soft. Everywhere people complain that they can't hear me. So yeah, I can say that we are a new kid in the block because we joined a coalition last year in 2021. And we started the discussion on the country-led evaluation, I think this year in 2022. And we have just completed the terms of references for that evaluation. Yeah, so our evaluation is mainly focusing on the unintended consequences of COVID-19 mitigation. We are focusing on the warfare of the people. And one of the common intervention that is being adopted by many countries is the social protection intervention. And under the social protection intervention, we are focusing on the cash transfers. For the cash transfers, traditionally, it focuses on the rural population. In Malawi, 80% of the population it's in the rural area, and most of them, they live below the poverty line. So the cash transfers focuses in the rural population, but because of the impact of COVID-19, the shift has been made, or I should say it has been expanded and considered the urban population. So I'm from the Monitoring and Evaluation Division. This division is mandated to coordinate as well as implement monitoring and evaluation of public policies, projects, as well as programs within the government. We do collaborate with the MDA's ministries, development ministries, departments, as well as the agencies within the government. As I indicated, our main functions are coordinating, monitoring of government programs, projects. We do evaluate, but also we are managing the implementation of government-wide monitoring and evaluation system. The previous speakers talked about the fragmented system. We have noted, we did the situation analysis on monitoring and evaluation, and we noted that we are working in silos. So this has prompted us to establish a government-wide monitoring and evaluation system. So right now we are in the process of setting up this government-wide monitoring and evaluation system, and it's a responsibility of the Monitoring and Evaluation Division. We are also working on the we have drafted the M&E policy. I think 2 weeks from now, we are meeting the PS committee on this evaluation policy. So it's also our responsibility to ensure the implementation of that policy once approved. We also do community-based monitoring and evaluation to ensure engagement of the citizens. We do public expenditure trafficking surveys, as well as the budget analysis to provide guidance in that area. We also do assess food security and vulnerability for humanitarian resource planning and resiliency building, but also capacity building, it's the responsibility of our division. So we looked at the impact of COVID-19 on the urban population. I think the effects are the same. The fatality of active labor force, loss of livelihoods, which lead to the reduced income sources, increased unemployment in the urban settings, but also it affected health-seeking behavior. Majority of the urban residents tended to shy away from seeking medical services due to high rate of death in the hospitals due to COVID-19. So to them, they concluded that if we go to the hospital, they will find us that we are positive, they will admit us, then we are going to die. Then also they disrupted social life. We are talking of the urban population here. So because of these effects, that's why the government decided to introduce, to consider the urban population and provide the cash transfer. So this mainly is intended to help mitigate the adverse health and economic effects of COVID-19 on urban population. They targeted the cities. We have 4 cities, that's Lilongwe, Blantyre, Zomba, and Mzuzu. They targeted 35% of the urban population. They had their own criteria of selection of these, the households to benefit from the cash transfers. There were specific variables that they considered. So the 35% of the household population was eligible for the cash social transfer. That is translated to 199,000 plus population. And each household was receiving 35,000 kwacha, which is equivalent to $42.7 per month. And they received for 3 subsequent months. So key stakeholders in this urban cash intervention, normally we call it KUSH, COVID-19 urban cash intervention. The key implementation partners in this, we have government of Malawi, supported by World Bank, KFW, EU, GIZ, UNICEF, World Food Program, but also ILO. Now, yes, there's this COVID-19 urban cash intervention that happened. Were there any evaluations that were considered or that were done before we thought of coming up with this evaluation? Yes, we had 2 evaluations. The first one was done by World Bank. It focused on the process. It's a process evaluation focusing on efficiency and effectiveness of implementation. I think the report on this one is available on their website. As a Ministry Monitoring and Evaluation Division, we came up with we did the impact evaluation, focusing on the direct impact. So we mainly focused on how the beneficiaries, if the intervention cushion the food security amongst the beneficiaries. On food security, we looked at the uptake of nutrition, but also the quantity of food consumption. Were they able to have food 3 times a day? So we had a team of beneficiaries, we targeted beneficiaries, but also a group of non-beneficiaries as the control group. So based on what we, all these operations, now when we had a discussion with the coalition, we said, in our case, we can focus on the unintended consequences, because many evaluations are focusing on the direct consequences. Right now, let us focus on the unintended. This is how we come up with this idea. So why should we care about why should we care about unintended consequences? They may complement or offset the main program benefits, but also they can provide a more balanced picture of the impact of the intervention, and it can assist the decision makers when they are deciding which intervention to take. The specific objective or specific areas that we need to focus, it's on the domestic violence, but also labor supply, any effect on labor supply, as well as the food insecurity among the non-beneficiaries. The methodology that we are taking, we are looking at the quantitative approach, the household survey, but also we are going to have case studies, key informant interviews, and the like. Lastly, this evaluation it's going to assist us a lot, especially when we look at the design and implementation of cash transfer programs in Malawi. We do have the Malawi Socio-Economic Recovery Plan, which also alluded to the continuation of the cash transfers as a way of accelerating economic recovery. There is the affordable inputs program. There is the in that area there is a debate whether to expand the cash transfer and abandon or reduce the affordable input program. So for them to make an informed decision, I think the outcome of this will assist them. So it will also guide both national and international stakeholders on future investment of cash transfers. Then how this collaborating benefit the national M1T system. I think there are so many ways on how we can benefit, like building capacity within the public sector, but also it can provide lessons for future global crisis, how we can manage the approaches we can adopt. International learning, cross-cutting, we are already here, we are learning a lot from peer-to-peer learning, but also the spillovers to non-crisis evaluations, any other evaluation, because we are going to learn a lot through this process. Thank you so much for your attention.
Thank you very much, Sophie. This is a very interesting exercise, and I remember some of the discussions that we had about the scope of this evaluation. Why do a third evaluation on a cash transfer program? And the team in Malawi has really developed a very clear, strong rationale around the magnitude of cash transfers as a social protection measure and the importance of it, but also the paucity of evidence on unintended consequences, which are clearly signs of those occurring. So there's a really strong rationale and interest in this evaluative exercise. So thank you very much. Then next, it's my pleasure to introduce our colleague from Ghana, Mr. Nana Opade, who is the Director of the Monitoring and Evaluation Division of the National Development Planning Commission in Ghana. Nana, the floor is yours. Thank you.
Thank you, George. And good afternoon, everybody. I appreciate you being here to listen to me and my colleagues, what we are doing in terms of the response recovery, the recovery response that we are. You have to click. Yes. Okay. Yes, as I've indicated, I welcome you, maybe on behalf of the president of my country and on my own behalf, being here this afternoon to indicate to you the steps that we have taken to enable us respond to the COVID-19 pandemic in the country Ghana. I believe that unlike my colleague Sophie, my voice is a deep throat one. So you do hear me very well. Along the line, I will deepen it. In Ghana, the National Development Planning Commission is the institution that is responsible for monitoring and evaluating the blueprint agenda for development in the country. What we have now is an agenda called the Medium-Term Development Policy Framework, which spans the period from 2022 this year till 2025. And basically, what we have done is to make sure that we have various key themes that we have identified for the country to track them and check whether the implementation of those themes are being worked upon by all sectors of the economy. The themes spans across the economic dimension, we have the social dimension, we have the governance dimension, we have the environment, and then the what we call the response recovery dimension. We have that one. So basically, we've been able to come out with all these themes, and especially we want to track what occurred in 2020, because we knew the pandemic was of some, it was a big blow to the country because it was unanticipated. So we've been doing this because we also, together with some partners, the institution, the National Development Planning Commission, together with partners, have been evaluating programs over the years across all the sectors in the country. So we felt that this pandemic will also be tracked, and then we will also look at what were some of the consequences on the economy. So the government of Ghana came out with the COVID-19 response in the country. And the framework that we have developed for the response is the CARES or BATAMPA. CARES meaning the COVID-19 alleviation and recovery, revitalization, and support for some groups in the country. So we have done this, we have prepared this document as the frame. And then, in order to ensure that it is being implemented, we have identified a number of local authorities. And the identification was based on the fact that we have 16 geographical regions in the country, but we can't be all the places at the same time. So what we decided to do was to make sure that, because we want to focus on what are some of the social activities involved in all these regions, we just took a sample of some of the districts, and I'll come to the district, so that we look at why have the social activities reduced, and then we'll look at why businesses got closed, the reasons behind that, and then why businesses have they've been closed, and then it has resulted in the reduction of wages, people are not going to work and all that. We want to understand the issue. So we took the number of districts for these interventions. There were 5 of them. The 5 were based on the various ecological locations. We have one populous region called the Ashanti region. Ashanti region has the 2nd largest capital in the country. So we use that, and the business that thrives over there was quite vibrant, but all of a sudden there were a close down of businesses and all that. So we wanted to understand why this is happening. Then we use a couple of the communities that are located, district assemblies, as in your terms, but local authorities located alongside the borders. We share borders with Côte d'Ivoire, we share border with Burkina, we share border with Togo. We have a coastal border with the Gulf of Guinea. So we were able to identify communities along the borders. On the northern side with Burkina Faso, we have a border called the Kassina-Nankana. We want to understand the movement of persons and goods and services from across the borders. Likewise, we did same for the eastern border with Togo, which has a district called the Ketu district and is the capital of Aplao. So we did that also. And then we used the most vibrant economic activity in the country, which is the cocoa growing area. And that is called the Seshiri-Osu region. So the northern west region, we were able to also do same. And then we identified these spots. And these were the hotspots for the activities, for economic activities in the country. So we identify as such. By so doing, we are now able to identify the support that was given by the Ministry of Finance to an agency called the Ghana Enterprises Agency to all small businesses in the country to support, especially women businesses. We'll be able to identify that through what we call the recovery plans that we assisted the assemblies that I've mentioned to prepare, in addition to the integrated financial, alternative financial support that we also sought for these assemblies. These were all part of the processes that has been done to ensure that women businesses, what is happening to the youth, the elderly in terms of persons with disability and all that were identified, and we got to understand what are the effects of the COVID-19 pandemic on their situations. So basically, I've explained all what I indicated by the scope where we have identified the 5 assemblies, the local authorities, and we are working with them. I have to say thank you in our local language is Medasi.
Thank you very much. Very clear presentation. And this is a really very complex program that covers a large variety of interventions across various policy areas. So it will really be a challenge to further refine the scope and refine the design, the evaluation design to develop a feasible and rigorous evaluation design that can work in practice. And we're working on that right now with your team. So that has been a great experience. So thank you very much. Maintenant, j'ai le grand plaisir de donner la parole à notre collègue à Burkina Faso, Dr. Kobiagda. Il est directeur général de l'économie et de la planification du ministère de l'économie, des finances et de la prospective. Alors, Dr. Kobiagda, la parole est à vous et bienvenue. Merci.
Merci beaucoup pour la parole. Je pense que ma présentation est visible. Vous me voyez?
Oui, on peut le voir. Oui, on peut le voir. Oui.
Ça marche. Alors, donc, à la différence, bien sûr, donc, du Ghana et du Malawi, où, en fait, donc, l'évaluation à proprement parler est déjà conduite avec donc, des résultats probants. Et pour le cas du Burkina Faso, nous sommes donc dans un processus donc, avec l'OCDE, avec Megan et Gina, dans lequel nous devons donc travailler. Et pour ce qui est donc de cette conférence nationale sur les capacités donc d'évaluation, je voudrais un peu plus ou moins donc restituer donc dans le cas du Burkina quels sont effectivement les grands chantiers sur lesquels nous travaillons en matière donc de capacité évaluative, mais aussi en matière donc de dispositifs mis en place au niveau national. Alors, très rapidement, si vous permettez, je voudrais rappeler, le Burkina est un pays, d'ailleurs, le communicateur du Ghana l'avait fait également mention donc, dans sa présentation. Nous partageons donc une frontière avec, bien sûr, le Ghana et autres pays donc, de la CEDEAO. Nous sommes un pays qu'on peut résumer globalement, un pays à tendance donc fortement tributaire de beaucoup de chocs. En dehors, bien sûr, donc, d'un des chocs qu'a été la COVID-19, nous sommes aussi donc dans une situation donc, de choc à la fois sécuritaire, humanitaire et fortement climatique parce qu'il est un pays fortement enclavé. Alors, le Burkina a un certain nombre de caractéristiques que mon PowerPoint ici présente. Nous avons nécessairement une population qui a forte majorité donc féminine, mais également aussi très jeune. Nous avons plus de 45% de la population qui est jeune. Alors, en matière donc d'évaluation au niveau national, on a essentiellement un ministère qui porte donc ces questions-là, même s'il y a des connexions avec les autres ministères. Et le ministère qui porte donc la préoccupation est bien sûr donc le ministère en charge donc de l'économie. Et au niveau de ce ministère-là, ma direction générale en charge donc de l'économie et de la planification porte donc la mission globale d'assurer la conduite des études exploratoires, de la planification stratégique et opérationnelle, ainsi que le suivi et l'évaluation donc de toutes les politiques publiques. Et dans ce sens-là, nous contribuons effectivement à un meilleur pilotage donc, de l'économie et du développement au niveau national. Alors, pour mener à bien cette mission, nous avons une structuration qui permet de retrouver l'ensemble donc, des départements ou des directions qui pourraient donc contribuer à cette évaluation. Parmi donc, les directions, je rappelle ici que ma direction est composée d'autour de 354 agents répartis donc en 6 directions techniques et 13 directions régionales réparties sur le territoire. Et chaque direction a une attribution en lien, bien sûr, avec donc, la mission globale donc, définie par le décret portant organisation, bien sûr, donc, du ministère à lui-même. Donc, nous avons par exemple une direction comme la direction des prévisions et des analyses macroéconomiques. C'est une direction qui contribue fortement donc, à l'évaluation ou à la simulation donc, des chocs potentiels donc, sur l'économie, ce qui permet donc une meilleure programmation, planification des actions engagées par le gouvernement. On a la direction donc, de la prospective et de l'intelligence économique qui travaille toujours aussi sur les questions d'anticipation, de vision à long terme. Et cette direction-là contribue significativement pour ce qui est donc des enjeux donc, de moyen et de long terme. On a la direction en charge de l'évaluation des investissements publics qui travaille surtout sur les questions des projets et programmes, un instrument privilégié du Burkina Faso en matière de mise en œuvre donc, des politiques publiques. Et on a la direction de suivi et de l'évaluation des politiques économiques et sociales, repris un peu plus ou moins sous forme de 2 directions. On a une direction aussi qui a en charge les questions de politique de population. Et comme je le disais, les directions régionales assurent auprès des collectivités territoriales la mission à la fois de planification, de suivi et évaluation. Alors, ce qu'il faut dire donc de la fonction suivi et évaluation au Burkina Faso, nous le retrouvons donc à la fois au niveau des départements ministériels à travers donc des directions qui ont été mises en place, notamment les directions en charge donc des études et des statistiques sectorielles, Et ces directions-là sont appuyées par des directions transversales, donc comme la Direction générale du développement territorial, le Bureau d'évaluation de la primature et bien sûr le secrétariat exécutif de la politique nationale. Et tout cet ensemble-là est fait sous la coordination de la Direction générale de l'économie et de la planification que je dirige. Et cette direction-là a vocation à présenter l'ensemble des outils qui devraient permettre donc aux différentes directions de travailler. Alors, j'avais déjà parlé donc de ces deux directions. Je ne reviendrai plus systématiquement donc sur ces deux directions spécifiques-là, qui sont les directions qui ont le plus gros mandat en matière donc de suivi et d'évaluation donc des politiques publiques. Et en la matière, il y a un certain nombre d'instances donc qui sont mises au niveau de ces directions. Et d'ailleurs, le collègue du Ghana, lorsqu'il intervenait, parlait de la Commission nationale de planification du développement. Au Burkina Faso également, nous avons cette Commission nationale de planification du développement qui a pour mandat surtout donc de regarder en amont, avant donc la mise en œuvre de toutes les politiques publiques, que ces politiques-là sont en phase avec donc la vision du pays. Au demeurant, nous avons mis en place également donc une commission nationale donc de l'évaluation. Et cette commission nationale de l'évaluation, aujourd'hui, joue un rôle donc dans tout ce qui est comme processus d'évaluation au niveau national. Mais je voudrais, avant donc d'aller dans le principe général de ce qui est arrêté, rappeler que lorsqu'on prend un peu le mécanisme de suivi et évaluation au Burkina Faso, on a 3 grandes périodes. Et ce qui fait donc que nous avons un peu un système donc d'évaluation qui est relativement embryonnaire et qui est vraiment en fort besoin donc de capacitation pour pouvoir mieux évaluer les politiques publiques. Alors, nous avons eu donc ce que nous avons appelé donc la période pendant laquelle c'était des plans quinquennaux qui étaient mis en œuvre et pour lesquels il ne s'agissait pas systématiquement donc d'une évaluation, mais d'une analyse donc en termes de résultats et voir donc comment il faut y aller. À partir du séminaire sur le renouveau de la planification tenu en 1994, nous sommes passés à une autre étape de notre planification qui s'est achevée autour donc des années 2010, mais là encore, l'évaluation demeurait donc significativement embryonnaire. Et à partir de 2011 à nos jours, nous sommes donc dans une période que nous qualifions donc de période portant les stratégies de croissance. Cela est un peu plus ou moins comme commun à l'ensemble donc de la sous-région. C'est à cette étape-là qu'on a vu donc davantage un essor substantiel donc de la fonction évaluative. Et cette fonction évaluative-là est devenue donc une exigence à tous les niveaux. Et cette exigence donc à tous les niveaux impose un peu plus ou moins donc que les instruments appropriés soient mis en place. Donc, vous avez la commission de l'évaluation des politiques publiques et de suivi des recommandations, qui est une commission qui a été mise en place au niveau donc des députés, notamment l'Assemblée nationale, ce qui permet un peu donc au niveau des représentants du peuple de pouvoir donc s'assurer que les politiques publiques sont évaluées et surtout que les recommandations issues donc de ces évaluations-là puissent donc se traduire dans les actes des gouvernements à venir. Nous avons bien sûr une loi qui a été adoptée en 2018 sur le pilotage et la gestion du développement, qui précise bien sûr donc les types de politiques publiques donc à mettre en place et également à suivre. Donc que ce soit au niveau central mais au niveau décentralisé, donc notamment au niveau des communes et des régions qui constituent donc les collectivités décentralisées du Burkina Faso. Et comme je le disais, bien évidemment, le décret qui met en place donc la Commission nationale de l'évaluation permet donc de prendre en charge globalement ces préoccupations. En dehors des instances donc parlementaires et étatiques, au niveau national, nous avons bien sûr une société civile assez dynamique qui travaille dans le domaine de l'évaluation. Nous avons essentiellement donc le REBUS et bien sûr donc le secrétariat permanent du Congo. REBUS, c'est le réseau burkinabé en suivi et évaluation, qui sont des structures fortement impliquées et qui travaillent effectivement à faire de la pratique évaluative à travers des évaluations sur les données probantes d'être une réalité donc dans nos contrées. À côté donc de ces acteurs à la fois politiques de la société civile, on a bien sûr les partenaires techniques et financiers qui interviennent donc au Burkina Faso et qui ont demandé davantage la systématisation donc de ces évaluations. Alors, donc, il y a un certain nombre d'instances, comme je l'avais dit, à tous les niveaux donc, de la chaîne, vous avez bien sûr donc, des acteurs prévus dans ce sens-là au regard des dispositions donc, de la loi sur le pilotage de l'économie. Alors, donc, ces cadres d'échange qui ont été effectivement mis en place ont permis au Burkina Faso, et du moins ça va permettre au Burkina Faso donc, de tirer une opportunité des échanges à travers l'exemple bien sûr donc, du Malawi, pour ce qui a été fait donc, du Covid avec donc, le système de cash transfert, pour ce qui est du Ghana également, donc des mécanismes qui ont été mis en place à la fois pour évaluer, mais en même temps apporter des solutions aux préoccupations. Nous pensons donc que c'est une belle tribune donc, de partage d'expérience entre pays, mais aussi entre praticiens. C'est également un lieu d'apprentissage pour les pays qui apprennent donc les bonnes pratiques, surtout donc nous qui sommes un peu en retard par rapport donc à cette évaluation. Nous avions au niveau du Burkina Faso, lorsque la COVID-19 est arrivée en mars 2020, avec les premiers cas, nous avons eu un certain nombre de mesures qui sont un peu considérées comme aujourd'hui des mesures classiques que tous les pays ont mis en place. C'était la question des fermetures des frontières, des mesures que nous avons prises qui étaient de 3 ordres spécifiquement, qui sont donc des mesures d'ordre social, des mesures donc de soutien à l'économie et bien sûr donc des mesures qui visaient un peu plus ou moins donc à défendre le tissu économique. Donc à la fois un soutien de l'offre, mais également un soutien donc de la demande. Alors ces mesures ont été implémentées dans beaucoup de départements ministériels, mais aussi donc au niveau donc des collectivités territoriales et sur l'ensemble du territoire. Ces mesures ont permis, bon l'an, mal l'an, donc l'impact sur les populations soit globalement réduit, que ce soit en termes de personnes non contaminées, que ce soit bien sûr donc en termes de personnes décédées. Ces éléments-là sont un peu plus ou moins effectivement maîtrisés. Mais l'impact sur l'économie a été quand même fort du moins du fait donc à la fois de l'effet conjugué donc des chocs dont j'avais dit antérieurement. Et pour nous, cette tribune est une bonne aubaine pour développer donc un réseau solide donc, de collaboration future avec bien sûr donc les acteurs et j'ai effectivement donc on a cette opportunité que Megan qui est là et qui travaille avec nous donc dans le cadre de l'évaluation que nous entrevoyons puisse donc permettre d'avoir de belles perspectives sur l'impact global donc, de la mise en œuvre donc, de ces mesures gouvernementales sur la résilience, entre guillemets, souhaitée du peuple burkinabé. C'est aussi une occasion donc, de nouer donc, des partenariats avec d'autres administrations et les mesures sous-régionales et internationales de promotion donc, des pratiques évaluatives. Et c'est dans ce cadre-là que nous avons effectivement souscrit à notre engagement donc de participer, mais au regard du contexte national et des évolutions, nous étions obligés donc de participer en visioconférence, mais cela n'est que partie remise pour les prochaines fois. Je vous remercie. Merci bien.
Merci beaucoup, Dr. Kobiakta. C'était une présentation très claire et très intéressante. Maintenant, on va continuer avec la discussion et vous aurez l'opportunité de répondre aux quelques questions dans quelques minutes. On va continuer maintenant en anglais. Merci. Right, esteemed colleagues, I have prepared some questions to pose to the distinguished panel. But in the interest of time, we have about 15 minutes left for this session. I would first like to open the floor and see whether there are any questions from the audience and then to kick off the discussion. Yes, I see a question by Andy in the back. We'll take a number of questions and then get back to you.
I know I'm Andy. Thank you, Stephen. This is most encouraging and exciting. I'd like to extend it a bit. I'm from Footprint Evaluation. One of the things we've done is interpret the most recent OECD DAC criteria through introducing natural systems and sustainability into each of the criteria, and they work very well. And we basically applied that in a case study where we looked at, the case study was if a country was to evaluate the use of personal protective equipment in the pandemic, how would you do it? using criteria that included natural systems. And at every stage, from preparation through procurement, through manufacture, shipping, transport, use, and disposal, there are very significant environmental impacts, hugely significant environmental impacts, and they could have been avoided at each of those stages. The document will shortly be on the footprint evaluation website. It was very illuminating, and I would just suggest that in the work you're doing, there's no reason not to also include sustainability. It's within the criteria, and it wasn't that hard to do.
Thank you. That was more of a comment, and there was a lot of comment and a question. Please keep your intervention short so we can give the floor.
Well, I would try to keep it short.
Yeah.
And I was working at FAO as an evaluation director when the COVID started, and now I'm working in the WHO. So I looked at it from the both sides, and looking at the pandemic, first and foremost, it was a health crisis, right? So the first effect was people getting COVID, and they started having some people have started to die and so on. Then the first reaction by the government was to impose, like some colleagues said, some restrictions on socioeconomic activities, travel bans, lockdowns, and also health measures such as promotion of washing hands and masks, and then a vaccination campaign. So, and then the secondary effect was that has impacted socioeconomic activities, and therefore people started to lose livelihoods and food security and so on. And you started to talk about these measures about caching, distribution cash and so on. So in evaluating for the future pandemic, which we know will be coming at some time, we need to really think about and evaluate what your government has done is in the right balance or not. Yeah. So if we haven't locked down, then what would have happened as opposed to because we locked down? Yeah, economic impact was this, but also there's some lives saved. Right? So my question is there any government or the evaluation that you have been conducted that addressed the first impact, first measures for the health impact, right? So how do you assess the health measures, etc.? Because then we can learn the lessons for the future in that.
Thank you. A very interesting question, also very elaborate, but thank you. Adeline.
Hi, so maybe my question is maybe a bit more understanding of the global evaluation coalition, because I think we heard from Malawi that there were previous evaluations done around COVID-19. I also know that there were other organizations outside OECD DAC that were supporting COVID-19. So I'm just wanting to understand the scope of the evaluation. Is it covering everything that the government did through support from everyone else outside OECD DAC, or is it focused on support from OECD DAC members only, so that we understand how you are dealing with contribution attribution and the other things of working in silos and so forth? So just an understanding of that.
Thank you. One last question, and then we'll turn to the panel. Okay, we'll add one more. Okay, please go ahead.
My question to the OECD, what is the growth strategy you see for the evaluation coalition? We heard about the work you're doing with the respective countries and governments, and how you're planning to expand, or what are other kind of topics and thematic areas you are going to focus in the next 3 years, let's say. Thank you.
Thank you. One last question in the back, and then we continue.
Thank you for very interesting presentations. I have 2 questions. The first one to Megan from OECD. Thank you very much for
all of the evaluation that you have conducted as OECD. My question to you is, what do you do with the results? Do you really disseminate them, or you just put them on the web page and everyone, anyone that is interested can download it? But do you really try to reach some policymakers, some decision makers, and make them, so not make them use, but I don't know, promote the results? And for the rest of the panelists, I have a question. Do your evaluations are informative in the way that you can use the results in case of other emergency or in other type of crisis, or are they really focused on COVID results and COVID effects? And that's all. So it's just a knowledge that we will have, but there is no practice, no practical information what to do in case of other crises. Thank you.
Thank you very much. Very interesting, wide array of questions. So I think we're going to answer in two phases. First, I would like to invite our colleagues from Malawi, Ghana, and then I will ask my colleague next to me, who's far more eloquent in French, to translate some questions for our colleague in Burkina Faso. We will give them an opportunity to respond to three questions. One was a question relating to, is there scope for dealing with environmental considerations in evaluation? The second question was, how or have you, or how would you look at the health impact of the pandemic? Have you looked at it, and how have you done it? And thirdly, what are some of the learnings, or can we learn from the current evaluation or other evaluations on COVID-19? Can we learn things that can also apply to other crises? So I'm going to ask Sophie to respond first, and then Nana. Environmental considerations in evaluation. So how can we make evaluations as an exercise, that's how I understand it, more environmentally sustainable, more environmentally friendly?
Thank you so much for those questions. I think our evaluations, as they indicated, they are country-led evaluations, and they are also collaborative. We are going to engage all the stakeholders. On the environmental part, I think we are going to take care of that as we continue with engaging with other experts in that. These evaluations, we are going to learn, I think, some lessons that will help us with the future crisis. But it also depends on the type of crisis that we are going to encounter. There are some crises that might be similar. I can give an example of Russia-Ukraine war. It has a similar, some of the effects are similar to the COVID-19 effects. So we can use what we have gained out of these interventions in the future crisis. Thank you.
Thank you, Sophie. Nana?
Yes, thank you, Jos. Yes, in Ghana, I indicated that for the environmental response in terms of what happens in crisis time. I've indicated that the framework that we have identified the emergency response bit for the period that we are undertaking the implementation of that particular framework. So we will definitely, in addition to what one particular agency does, the Environmental Protection Agency, they do conduct impact assessment periodically on some programs. We at the Planning Commission will team up with them to undertake some of these impact evaluations, especially on the procurement value chain that you mentioned. We will definitely do that because it's part of our framework for the period 2022 to 2025. Then in terms of ensuring sustainability, the health systems and all that, we have not done that post-COVID, no. But I believe that in discussions with the health sector, we'll be able to also come up with what we need to do. What we have done is what I indicated about the consequences of the COVID on the economic impact. That's what we are trying to do in terms of how businesses fell out, how the closure, the impact, loss of income and all that. We are looking at that, but not without saying that we will go back and look at what we will also do in terms of the health sector. We'll do that. In terms of the policy and the disseminating of the results, this particular evaluation will look at making sure that we share the outcomes of whatever we are able to understand with policymakers for the next evaluation or for the next crisis cycle. We hope it does not come, but we can't beat nature, it will come. So what then will we do in case it happens? So that is what we have in place. So we have the national evaluation policy in place now. We hope that we'll bring all stakeholders on board, we'll engage them and discuss extensively what we are supposed to do in terms of crisis situation, which we have identified as a team in the policy framework that we have now. In terms of the implementation, coordination, and monitoring, then we evaluate whatever happens. We have it on board in our framework now, and we will be doing that in due course.
Thank you, Nana. Just a very quick remark on the environmental footprint issue and evaluation. In this context, we are talking about a long-term process in which hopefully we're all trying to work towards empowering and strengthening national monitoring and evaluation systems, which would go along with a reduction of evaluations commissioned and conducted by international development partners. The environmental impact of that would, of course, be very significant. So hopefully we will get there. And I'll give the floor to Megan, who will translate the questions in French because she's far more eloquent than I am. And we give the floor to Dr. Kobiakti. Thank you.
Donc, merci. Je remercie beaucoup les interprètes qui travaillent beaucoup en ce moment. Le problème, c'est que nous n'avons pas de lien avec les interprètes pour la connexion Zoom. Donc, Dr. Kobiakti, c'était juste pour très brièvement traduire les 3 questions qu'il nous a posées, Dios, à la base des commentaires des questions reçues de la public. Donc, la première, c'est concernant la prise en conscience des impacts environnementaux dans les évaluations. Par exemple, le collègue a donné l'exemple d'évaluer l'impact des masques et des autres outils de protection personnelle qui ont été déployés pendant la pandémie. Donc, est-ce que vous avez des perspectives concernant l'aspect environnemental dans les évaluations que vous voyez à Burkina Faso? Le deuxième, c'est concernant l'impact sur la santé ou la première réponse de la pandémie, les fermetures de frontières, etc., leur efficacité envers l'impact direct sur la santé de la COVID-19, de freiner les contaminations par la COVID-19 et la mortalité. Et le troisième, c'est concernant la dissémination, voilà, la communication des évaluations et leur utilisation, comment on propose à ne pas simplement de produire des rapports d'évaluation, mais à aider les preneurs de décision à prendre en compte nos résultats. Donc, si vous avez des autres expériences et surtout, qu'est-ce que vous voyez comme l'utilité de l'exemple de COVID-19 pour des autres crises? Et peut-être, bon, vous êtes très bien placé pour en parler, comme votre pays subit malheureusement plusieurs crises en ce moment. Vous pouvez parler de votre perspective, comment on peut utiliser les leçons tirées de la réponse à la pandémie pour répondre à des autres crises dans les autres contextes. Merci.
Merci de répondre aux questions et si possible, vous pouvez être bref, monsieur. Merci beaucoup.
Merci, Megan. Merci pour les préoccupations reprises pour nous. Alors, je vais aller assez rapidement par rapport aux 3 préoccupations et certainement terminer avec donc, la dernière qui est comment on pourrait utiliser les évaluations dans le cadre des autres crises auxquelles nous faisons face. Alors, il faut rappeler que pour ce qui est du processus d'évaluation que nous envisageons au niveau du Burkina Faso, cette évaluation tient compte de l'ensemble, en fait, donc, des éléments qui sont liés aux différents axes sectoriels sur lesquels nous avons travaillé. Nous avons un axe, effectivement, qui portait donc sur les questions donc, de santé publique. Il y avait un axe qui portait, bien sûr, donc, sur les autres acteurs pour faire juste donc, court. Mais pour ce qui est donc de l'impact donc de l'utilisation d'un certain nombre de mesures, notamment sur l'environnement, nous pensons pouvoir davantage le prendre en compte donc dans l'évaluation ici. Il est certes vrai que dans le cas du Burkina Faso, aux premiers instants, tout ce qu'il y avait comme mesures qui avaient été établies, notamment avec l'utilisation donc des gels hydroalcooliques, l'utilisation donc des masques, des cache-nez, nous sommes préoccupés effectivement donc de quel pourrait être l'impact de tous ces produits qui ont été utilisés là sur l'environnement national et sur les conditions de vie des populations par la suite. Du reste, l'évaluation est envisagée et certainement que dans le processus, nous allons voir effectivement qu'est-ce qui pourrait être fait pour permettre donc ces produits ou donc ces différents éléments qui ont été utilisés donc pour préserver la vie humaine ne servent pas par la suite donc pour agir négativement donc sur l'environnement et sur la durabilité en fait donc des systèmes nationaux de protection. Et l'essentiel, c'est que nous intégrons l'impact donc sur l'environnement en termes donc d'évaluation, en plus donc de prendre en charge donc les questions liées à la pertinence, à la cohérence, à l'efficacité, à l'inefficience et autres donc dans notre évaluation. Alors, il faut rappeler également que pour ce qui concerne le deuxième grand point, pour aller assez rapidement, la fermeture, par exemple, des frontières, pour nous, à date d'aujourd'hui, en attendant d'aller vers une évaluation beaucoup plus exhaustive, elle a contribué au premier instant, peut-être donc parce que le système ne permettait pas donc un contrôle systématique des personnes déjà contaminées. Et comme on connaît donc l'effet donc de la COVID, avec donc l'effet de transmission très rapide, le fait même donc qu'il y a une période d'incubation de la maladie qui permet systématiquement à la personne toujours de contaminer d'autres personnes sans bien sûr donc déjà développer donc les symptômes visibles de la maladie. Tous ces aspects-là ont permis donc de limiter les effets parce que les entrées et sorties allaient être... Mais à moyen terme, on peut estimer donc que les fermetures de frontières ont plus exacerbé les conséquences, surtout donc au niveau social et économique. Et que pour la santé publique, même si ça a permis donc de résoudre au départ, mais par la suite, lorsque nous prenons le cas du Burkina Faso, nous avons fermé les frontières, on a fermé les administrations, bon, pas fermé, on a mis un peu en berne donc un certain nombre d'activités dans les administrations. Mais lorsque nous les avons à la limite remises en place comme il se doit, en demandant aux gens donc d'observer les mesures barrières, on n'a pas eu donc une propagation exagérée du nombre de cas. En d'autres termes, c'est des mesures qui, à la limite, pouvaient donc être considérées comme des mesures utiles au départ, mais en réalité, ces mesures n'ont pas empêché, ou du moins, bon, en tout cas, la propagation de la maladie n'a pas été aussi fulgurante comme ce qui avait été prédit donc, pour amener donc, ces mesures-là dans le cas, donc, par exemple, du Burkina. Malheureusement, pour ce qui est donc de beaucoup de pays africains, après même qu'on ait levé les mesures donc, de fermeture donc, des frontières parce qu'on semblait mieux connaître la maladie, mieux maîtriser les canaux de transmission et comment on pouvait même peut-être faire les tests, certains pays ont profité de cela donc, pour ralentir donc, les mouvements de personnes entre donc, plusieurs pays, et ce qui n'est pas de nature aussi donc, à améliorer le bien-être collectif. Bon, je pense que, en tout cas, nous allons faire un peu une évaluation. En matière de dissémination, pour aller très rapidement, pour la dissémination, nous pensons que lorsque nous aurons les résultats de cette évaluation, comme nous l'avons dit, la Commission nationale de l'évaluation serait donc saisie Et cette commission est composée donc de plusieurs acteurs. Je disais tout de suite, vous avez à l'intérieur des acteurs gouvernementaux, vous avez ceux de la société civile, vous avez des universitaires et des chercheurs qui sont associés donc dans ce cadre-là. Et nous allons travailler à mettre des policy briefs donc à la disposition donc des différentes autorités ministérielles de manière à comprendre donc comment cette maladie a pu impacter et quelles peuvent être donc les conséquences donc probables éventuellement en termes de mesures qu'il faut apporter. Et certainement, est-ce que les mesures gouvernementales ont été les meilleures mesures? Et systématiquement, nous allons pouvoir donc renseigner davantage donc les acteurs. Donc, nous pensons à un schéma de communication de type de haut vers le bas, à travers déjà donc les premiers responsables des départements ministériels, mais par la suite donc l'ensemble des acteurs et surtout donc les collectivités territoriales. Nous pensons surtout communiquer avec donc les représentants désignés que nous appelons les conseillers municipaux et bien sûr au niveau donc de l'État central donc les parlementaires qui vont être les porte-voix donc des résultats de cette évaluation. Mais en même temps, cette évaluation pourrait donc servir et dans le cadre donc dispositif que nous avons mis en place pour ce qui concerne donc Covid, parce qu'on avait créé un comité national de réponse donc à la crise donc de la Covid-19. À la date d'aujourd'hui, avec donc la crise humanitaire, on a créé la crise humanitaire qui est la conséquence de la crise sécuritaire. On a créé effectivement une commission nationale qui a pratiquement donc la même mission, mobiliser les ressources, apporter des solutions opérationnelles directement aux populations et rendre compte donc régulièrement donc de l'état de mise en œuvre. C'est déjà quand même une bonne leçon que nous avons appris donc du fait donc de la gestion de la COVID que nous utilisons dans le cadre donc de la crise, ce qui est donc déjà une donnée probante. Mais en même temps, ça nous a permis donc de mettre en place donc un dispositif institutionnel sous forme d'un arrêté qui permet que lorsque le pays fait face à un choc quelconque, que ce soit un choc climatique lié par exemple à une situation donc de sécheresse ou bien à une situation liée donc à des pluies abondantes qui créent donc des situations difficiles, que nous puissions donc répondre assez rapidement. Et ce mécanisme-là intègre les acteurs nationaux gouvernementaux, mais intègre aussi donc la société civile et bien évidemment les partenaires techniques et financiers avec tout ce qu'on a comme instance donc de lutte contre la corruption, parce que c'est pendant ces périodes de choc-là aussi que certains profitent donc pour chercher donc les moyens de s'enrichir en ne passant pas par des voies légales. Donc, les instances donc, de lutte contre la corruption ont été associées à ce processus, notamment pour ce qui est du volet mobilisation.
Excusez-moi. Je suis très désolé. On a plus de temps, donc vous pouvez finir votre intervention dans 30 secondes.
Non, j'en ai fini. J'en ai fini. Merci beaucoup. Merci.
Merci beaucoup. Esteemed colleagues, we are at the end of our session. There were some very interesting questions around what is the scope of the Global Evaluation Coalition's work. What is next on the agenda? What can we expect? How are results going to be shared? Megan has all the answers. Please seek her attention after the session. She will explain it all in detail to you. I think we have to go back to the plenary room for the closing session today. So I think we had a very interesting discussion this afternoon. I would very much like to thank our colleagues from Malawi and Ghana, from the OECD DAC, et aussi, je voudrais remercier notre collègue à Burkina Faso, Dr. Kobiagda. Merci beaucoup pour être avec nous ici et pour votre temps. And I would really like to thank you for your attention. This is really important work. We are very enthusiastic and we look forward to interacting with you on this project going forward. Thank you very much.
Colleagues, please join us back in the Piedmont for